I'm Dr. Dalla, Vecchia, and I'm a breast surgeon with Henry Ford Health. When you're in medical school, you get to have an opportunity to see all the various different specialties. And I seem to really find that the surgery specialty was where I felt most comfortable. It seemed as though you could make a real difference in a way that was concrete and measurable. So early on, I knew I wanted to do surgery. And then as a female in general surgery, very often you see a lot of breast patients and breast cancer patients. And so over time, my practice became much more focused on breast surgery in general. Looking at survival from breast cancer, a lot has been impacted by the use of screening mammograms. Once women get into a habit of doing screening mammograms, the goal is that we find something long before you'd ever feel it, and that's going to definitely have an impact on survival related to breast cancer. It's obviously a very scary diagnosis for any woman to get, and so realizing that there are things that we need to address. We can't just talk about the surgery. We've actually got to talk about what's your support system and would you benefit from talking with other women who've gone through this. The things I would be looking for in a physician are the things I try to emulate. Somebody who's a good listener, somebody who takes the time to explain things, somebody who's excellent in their field and is being current and relevant with newest research and trials and things like that. Interesting dynamic that occurs between a patient and their oncologist, because this is such a life-changing diagnosis, and so you definitely want somebody who you can feel you can put your complete trust in. So looking at how patient survival with breast cancer has been impacted in the last 20 years or so, there's a lot of different components to it. As surgeons, we've begun to recognize that we have more options to offer patients in terms of what we call systemic therapies, chemotherapies, and endocrine therapies, medications that can be taken, all which are resulting in some pretty amazing survival statistics for patients over long term. One of the things I think I find so satisfying is anytime a patient comes to see me and they say, my neighbor told me to come see you, my friend told me to come see you, when they tell me the nurses at the hospital said they wouldn't send their family anywhere else. That's the things I love to hear, because that tells me I did my job well. I'm Dr. Dalla Vecchia, and I look forward to helping you with any of your breast health needs.